Good afternoon. This is Shanna Dethi at the Digital Health Live studio at CES 2019. I have the privilege today of talking with Ryan Lakin, who is the head of research and development for Abbott.
Great, thanks for having me.
Welcome to the studio. So, how is Abbott developing technologies that put people at the center of everything?
Well, thanks. Abbott is fundamentally not focused on innovation or iteration for the sake of development. We're really trying to put people who don't want to be patients at the end of the day, and by putting the patient at the center of all innovation that we're driving forward, we truly think we can transform healthcare and specifically chronic pain therapy. For example, today Abbott uses Apple products and the iOS platform, as well as low energy Bluetooth for wireless communication, which has enabled us to truly connect the patients better with their devices. If you go back years ago, people would be very focused on managing the device. And I think through the innovations that we brought forward, we've been able to make people focus more on managing their chronic condition. And so as we are here at CES, we see a lot of technologies that can really enable the innovation to continue to move forward so that we can get people to reduce the burden of managing their chronic therapy.
Right, so you were just on a panel about the opioid crisis
Yep.
that we have here in the United States. How does the type of things you're working on help us with that?
Yeah, so if we go and we focus on what's best for the patient, I think that we all would agree that opioids are not the answer for chronic pain. At the same time, we need to focus on what the right therapies are for that patient population. And as we think about neuromodulation and connecting devices between the physicians as well as the patient, these devices generate all kinds of data that fundamentally can help physicians react and monitor that patient and react in a more effective way, thus reducing the burden of managing that disease for the patient.
Yeah, got it. So how much do you think does patient compliance, even when using any kind of device with taking their medications and everything, fall into this? And what have you seen?
Yeah, so I think we continue to drive innovation to make sure that our devices that we manufacture, our neuromodulation devices at Abbott, are used in the most effective way. And so to do that, we work closely with physicians in the development of these solutions, as well as working with patients on really making sure that we're developing things that are best have positive patient impact, but at the same time generate clinical evidence so that there's more support for that.
Great. So it sounds like you're creating things that people actually will want to use and not that we're making them use.
Yeah,
is that correct?
Yeah, ideally when we do a better job putting the patient at the center of our innovations, we will create the opportunity to reduce the burden and make it easier for people to use the neuromodulation technologies that we have.
Fascinating. Well, thank you so much for joining us today.
Thank you.
And this is Shanna Dethi live at Digital Health Studio at CES 2019, hosted by Living in Digital Times.